Welcome everyone to Bone Voyage, a podcast dedicated to prevention and raising awareness of musculoskeletal disease. My name is Dr. Kranti Peddada, an orthopedic surgeon, bone and joint health advocate, and your host for this show. Come join me as we embark on this journey to better bone and joint health. Welcome everyone to another episode in our knee arthritis series. In the last episode, we talked about what arthritis is and specifically focused on osteoarthritis, which is age-related wear and tear of a joint. We also talked about some risk factors for developing osteoarthritis and revealed that the joint most frequently affected is the knee. In this episode, we will talk about signs and symptoms of knee osteoarthritis, how we diagnose it, and other common causes of knee pain that may mimic osteoarthritis. As always, please keep in mind that everything presented here is purely informational, should not be interpreted as medical advice, and does not create a doctor-patient relationship. Please consult a physician or another qualified healthcare provider with any questions you have regarding a medical condition and before you make any changes in your healthcare behavior. Everything I discuss is strictly the opinion of myself and does not reflect the views or position of any entity I represent. Please reference the episode description for a full disclaimer. With that, let's get right into it. The most common symptom of knee osteoarthritis is pain. Although the pain can radiate a little down the lower leg or up into the thigh, the pain is usually focused around the knee. Furthermore, arthritic pain is present with weight-bearing activities such as standing and walking and is significantly less when sitting or lying down. The pain intensifies with longer duration and higher impact weight-bearing activities. For example, going on a 60-minute walk will likely be more painful than a 10-minute walk, and running will be more painful than walking. As the arthritis becomes more advanced, your activity threshold before experiencing pain will diminish. Early on, you may only notice pain after a 30-minute run, but have no pain whatsoever when walking any distance. This may then progress to not being able to run at all, and perhaps just being able to walk for 10 to 15 minutes. Eventually, the pain may interfere with daily activities such as being able to shop at the grocery store. A second characteristic of arthritis pain is that it's progressive. Unlike many knee injuries, such as sprains or contusions where the pain subsides completely after a period of rest and recovery, the pain from arthritis is progressive. However, that progression is usually slow. That change from being able to walk 60 minutes to 10 minutes doesn't happen over the course of days, but usually months or years. Arthritic pain not only progresses over time, but it also fluctuates. It's very common to have exacerbations or flares of pain that can last days or weeks. You might be going on a 3-mile walk one day, but then for the next several weeks you're limping and can't walk for more than 10 minutes. This temporary increase in pain can be triggered by overuse, minor injuries, changes in the weather, or other causes. Another symptom of knee osteoarthritis is stiffness. It's common for the knee to lose flexibility. You may notice that the knee may not be able to straighten out completely or bend as far as the other unaffected knee does. This feeling of stiffness may be worse in the morning after waking up, sitting for a long period of time, or when the weather gets colder. Arthritic knees don't move as well because of increased friction due to cartilage wear, bone spurs that limit range of motion, swelling that causes the knee to feel more tight, and contractures of the supporting structures of the knee such as the capsule, muscles, and ligaments. In addition to becoming stiff, arthritic knees may also lose their normal shape or alignment. It's very common for joint degeneration to be asymmetric, meaning that one half of the knee might wear out a lot more than the other half. This causes the knee to tilt towards the side that's worn out, like a seesaw tilting towards the side that's heavier. The inner side of the knee more commonly wears out, causing the knee to have a bow leg shape. Less commonly, the outer half of the knee wears out preferentially, causing the knee to have a knock knee shape. Other symptoms of knee osteoarthritis include crepitus, which is a sensation of crackling or grinding in the knee due to a loss of smoothness of the joint surface, swelling, which occurs because of inflammation in the knee, and weakness. Weakness is an indirect consequence of arthritis and occurs because the muscles around the knee lose strength from inactivity, disuse, and preferential use of the opposite leg from pain. Pain in conjunction with weakness can lead to buckling of the knee, instability, and an altered gait. Although many of the symptoms we just discussed are common in knee osteoarthritis, they are not exclusive to it, meaning that many other knee conditions can present similarly. This is important because it illustrates that you cannot definitively conclude somebody's symptoms are due to arthritis based on just talking to them and examining them. Many medical conditions, like diabetes, need blood work to confirm the diagnosis. For arthritis, the confirmatory test is usually an X-ray. Although you can't directly visualize cartilage on an X-ray, you can assess how much of the joint has worn out by looking at the amount of space left between the bones. A large amount of space is indicative of a healthy amount of cartilage still present, whereas significant narrowing or complete loss of space resulting in bone-on-bone contact means that the cartilage has completely eroded away and the arthritis is advanced. Bone spurs are also usually present on X-rays when arthritis is present. Bone spurs are small bony growths that develop from excess stress on the joint as the shock-absorbing cartilage erodes. What if, despite having a lot of the symptoms associated with knee arthritis, the X-rays look relatively normal, meaning there isn't much joint space narrowing or bone spurs present? There are two possibilities. Either the cause of knee pain is something other than arthritis, which usually is the case, or the arthritis is very mild and hasn't yet become visible on X-rays. Some alternative causes of knee pain, such as tendinitis, bursitis, and IT band syndrome, are overuse injuries and typically improve with rest and a physical therapy program. If this is the case, your doctor may not recommend any other studies. One type of knee injury that can mimic arthritis in older individuals is a meniscus tear. The meniscus is a crescent moon-shaped structure that rests between the bones of the knee joint. There is one meniscus for each half of the knee. The meniscus is technically also made of cartilage, but it's a tougher and denser version called fibrocartilage. It serves as extra padding inside the knee, and its primary function is to provide shock absorption. It also helps stabilize the knee joint. Meniscus tears can occur following an obvious identifiable injury where the mechanism is usually a forceful pivoting or twisting movement of the knee, or from activities such as kneeling, squatting, or lifting something heavy. As we get older, the quality of the meniscus tissue degrades, and meniscus tears can occur after just everyday activities. If your doctor is suspicious of a meniscus tear, he or she may order an MRI scan of your knee. Unlike an X-ray, which primarily highlights bony anatomy, MRI scans reveal a lot more detail about other structures including the cartilage, muscles, tendons, ligaments, and meniscus. An MRI is useful for diagnosing meniscus tears, ligament and tendon injuries, and early arthritis not yet visible on X-rays. Let's recap what we talked about in this episode. The most common symptom of knee osteoarthritis is pain. The pain is usually present with weight-bearing activities, which are activities that involve being on your feet such as standing and walking. The pain usually improves when sitting or lying down. Higher impact and longer duration weight-bearing activities can make the pain worse. The pain usually progresses over the course of months to years, and it's common to have self-limiting episodes of severe pain or exacerbations. Other common symptoms of knee osteoarthritis include stiffness, a sensation of crackling or grinding in the knee, a change in knee alignment making it appear bow-legged or knock-kneed, swelling, and weakness. Knee osteoarthritis is a diagnosis that requires imaging, and X-ray is usually sufficient. If somebody has symptoms of knee pain and X-rays do not demonstrate arthritis, other causes of knee pain must be ruled out. Sometimes an MRI scan is necessary to diagnose structural injuries such as a meniscus tear. In the next episode, we're going to talk about some initial treatments for knee osteoarthritis. I wish bon voyage to all of you on your journey to better bone and joint health. See you next time.
Thank you for tuning in to this episode of Bon Voyage, your journey to better bone and joint health. Please join us on Wednesdays for new episodes. If there are certain topics you would like to listen to, or if you have feedback for the show, please email us at bonvoyagehealth@gmail.com. If you enjoy listening, please follow and subscribe to our podcast. Thank you for all your support.